Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Hysterectomy. Discharge Instructions. Introduction. You had a hysterectomy. A hysterectomy is a procedure that is done to remove all or part of a woman's uterus. Discharge instructions are specific directions for you to follow when you go home. The following discharge instructions will help you learn how to take care of yourself at home and when to call your healthcare provider. Ask your healthcare provider if you have any questions about your discharge instructions. Make sure that your health information and self-care instructions are shared with your primary healthcare provider. Incisions. You will have one or more incisions after a hysterectomy. These incisions may or may not be covered with dressings. Your healthcare provider will tell you how long you need to keep your incisions covered. During surgery, your incisions may have been closed with glue, Steri-strips, stitches, or staples. If glue or Steri-strips were used to close your skin, do not try to remove them. Let them fall off on their own. This usually happens within 10 days. If your incisions were closed with stitches or staples, the incisions should be kept dry until the stitches or staples are taken out by your healthcare team. This is usually within 7 to 10 days. You may place an ice pack on the incision areas for the first few days after surgery. This can help reduce swelling and pain. To prevent pain, hold a pillow against the incision areas when you laugh or cough. You should also hold a pillow against the incision areas when you get up from a lying or sitting position. Activity. Your healthcare provider may limit your activity after a hysterectomy. These limits can last for a few days or weeks. Slowly increase your daily activities while you recover. Ask your healthcare provider when you can return to your normal activities. Someone else will need to drive you home from the healthcare facility after the procedure. It may take a day for the full effects of the sedative used during the procedure to wear off. Rest and relax after your procedure. You may feel weak or tired after the procedure, but it is important for you to walk. This helps prevent fluid buildup in the lungs. It also helps prevent blood clots in the veins of the legs and pelvis, which could travel to the lungs and lead to death. Avoid sitting for long periods of time. When you sit, prop your legs up to help prevent blood clots from forming. Vaginal bleeding and watery or bloody discharge may happen for a few weeks after the procedure. You may want to wear a sanitary pad for bleeding. Do not use tampons or douche until your healthcare provider says it is okay. Don't take a bath or use a hot tub for at least 1 to 2 weeks. Do not go swimming until your healthcare provider says it is okay. Do not lift any weight greater than 10 pounds, 4.5 kilograms, for about 6 weeks after surgery. Avoid strenuous activities and exercise until your healthcare provider tells you it is okay. Do not have sex until 6 weeks after the surgery or until your healthcare provider says it is okay. This operation will not change your sexual lifestyle or sensations. Do not drive while taking strong pain medications. Your healthcare provider will tell you when you can drive again. Stop smoking if you smoke. Smoking makes it harder for your body to heal. Talk to your healthcare provider if you need help quitting.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Diet. You may feel weak or nauseous after the procedure. Eat small meals frequently. This can help prevent nausea. Choose soft foods that are easy to digest. Soups may also help settle your stomach. Drinking a lot of water and other fluids can help prevent dehydration. Avoid drinking carbonated beverages like soft drinks for the first few days after surgery. Constipation is common after surgery. Take a stool softener as needed for the next 30 days. Eating foods that are high in fiber and drinking plenty of water can also help prevent constipation. Medications. Your healthcare team will give you specific instructions about how to take your medications. Take prescribed medications as directed by your healthcare provider. Ask your healthcare provider how often and for how long you should take each of the medications they prescribe. Make sure you understand the reason for taking the medications and their possible side effects. Check with your healthcare provider to see if there are medications you need to avoid. Tell your healthcare provider which medications you normally take and ask which ones should be continued when you are discharged. If some of your medications had to be stopped, ask when you can start taking them again. This is especially relevant for blood thinners. When to call your healthcare provider. Some vaginal bleeding is normal after a hysterectomy. You may also have watery or bloody discharge for several weeks. Call your healthcare provider if you notice foul-smelling discharge or severe bleeding from your vagina. Tell your healthcare provider right away if you develop any of the following symptoms: a fever higher than 100.4 degrees Fahrenheit, 38 degrees Celsius, chills, dizziness, severe abdominal pain. Call your healthcare provider right away if you have constant nausea or vomiting, difficulty urinating, drainage or bleeding from an incision, redness or swelling around the incision area, separation of an incision. If you had an IV during your procedure, contact your healthcare provider if you notice signs of an infection where the needle was placed. These include bleeding or drainage, pain, redness, swelling. You should also contact your healthcare provider if you experience symptoms of a blood clot in the legs. These include chest pain, leg pain, shortness of breath or breathing problems, swelling in your leg. Contact your healthcare provider if you have any questions or concerns about your discharge instructions.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Follow-up. Go to all of your scheduled follow-up appointments. Call your healthcare provider if you need to set up the appointment. During the follow-up visit, your healthcare team will make sure that there are no complications and that you are recovering as expected.
Thank you for using Explain.